Welcome to Snip and SIP, the podcast where we cut through the noise about plastic surgery while sipping our drink of the day. I'm your host, Dr. Scottsdale, from my real name, Dr. Mata. We're gonna talk about funny, we're gonna talk about trends, we're gonna spill the tea and all the secrets. Welcome back to Snip and SIP. This is episode number 3. I'm joined by my lovely co-host, who happens to be my wife, Nurse Scottsdale. And who are you?
Who are you? I'm just kidding. I'm Alondra. I'm the social media coordinator.
See, she doesn't even know what she is.
I got nervous and I was put on the spot. I'm the social media coordinator and her sister.
So yes, this is a family podcast so far, but don't worry, we'll have other guests besides these two beautiful women, and maybe I'll exclude myself from future episodes. But what are we talking about today, Nurse Scottsdale?
Today the topic is traveling abroad for surgery, yay or nay?
So what do you think about the topic, Alondra?
I think there's pros and cons to both. I've definitely considered it myself previously.
For what?
When I was younger, I really wanted a rhinoplasty so bad. And all I would see online was girls going to Turkey to get their nose done. And
it's like dirt cheap, right? It's
yeah.
like $3,500,
yeah,
$4,000?
like $3,000. And it includes like your plane ride, your stay, like a driver, like.
The plane costs $2,000 to get to Turkey. If it's $3,000,
that was back then. I don't know now.
So this was just purely for the financials because it's not expensive.
Yes, but also like from what I saw before is like they do a lot of noses over there. So.
Everybody there has a big schnoz.
Yeah, so they do a lot of noses. So I'm like, okay, well they're specialized in it and it's cheap. So yeah, I have considered it before.
Well, I know we started talking about this, but again, our podcast is called Snip and SIP. So what is our drink of the day, guys?
It's a piña colada, freshly squeezed by moi.
With what? What did you squeeze? You squeezed the pineapple?
I grew I grew my own coconuts. I grew
on your chest?
No, I grew pineapples. I grew all of it. And then I freshly squeezed it.
It's actually pretty good.
Yeah.
It is quite good. Salud.
Salud.
There you guys go. That's a drink of the day.
Damn.
Yeah, that is good. It's quite tasty, actually. And I don't like alcohol, so.
Yeah, that's what I do. That's what I do, guys.
On your part-time?
In my part-time. I am a bartender part-time.
Where?
Top Golf. So
there you go. If you want
Weren't you
to
working
meet
somewhere else too?
For bartending?
I thought you were at Whiskey Row.
Oh, I quit Whiskey Row. Yes. Yes. We don't talk about Whiskey Row.
We don't talk about what happens at Whiskey Row.
What happened at Whiskey Row stays at Whiskey Row.
So I think, going back to the subject of traveling abroad, we actually just got back from Mexico. Maybe that's why I look a little darker than usual.
Have a nice tan going on.
And you guys missed the dreads. We both had nice dreadlocks.
They were both Drake.
Yeah. I don't think she looks like Drake, but
you were Drake's vibes. But
I was the brown Drake.
Yeah, you were giving Drake for sure.
Yeah. I'll take that. I mean, it is what it is.
Pre-surgery. I'm just kidding.
But we just got back from Mexico. And, being a plastic surgeon, it's one of the hardest things we do is take care of patients, especially when it's elective. And they don't have money. They don't have resources. That's why people go to the emergency room. And when I first started training, it's my first exposure to people traveling to other places, not staying in the city that they're in to have plastic surgery. And it never made sense to me. But the reality is I kind of see some aspects of things that if locally you don't have what you want, then you're going to have to go somewhere else to get it. Like if I bought a car and they don't have the car that I want here, I might have to order it from somewhere and then have it delivered here. But when it comes to surgery, you can't have surgery delivered to you unless you're maybe like a billionaire, and then maybe you could fly your surgeon and send them to the hospital, and then you show up, they do the surgery, and you fly them home. I know that happens actually in the Middle East. One of my professors actually got flown out, got paid $1 million to fly out with his team, do surgery, put him up in a not 5-star hotel, but like 7 or 8 stars, whatever stars they have there, and then they flew him home after 3 weeks.
Must be nice.
I'll be part of your crew.
I'm
with
included because I have to record.
Right? But yeah, he got paid $1 million for his entire team and everybody to get put up and to do surgery. So,
But that's not the major.
No, he's very specialized in what he does. He does hair transplants. So they literally flew him out to do hair transplants in the Middle East. And that was one of my first exposures that I was like, oh my gosh, that's a lot of money. Why don't you do this full time? He's like, because I got to stay there for 3 weeks.
Still, if you're making $1 million.
Yeah, but if I like disappeared for 3 weeks just to go make money, you'd be like, bye, Felicia.
Okay, just
For
bring me the money.
Yeah. Just split it even.
Just come back, give me the money, and then go back.
Just stay there full time and send the money back to the U.S.?
Yeah, I'm okay.
Is that what you would want?
Yeah, I'm okay with that.
Okay. So I'm officially a sugar daddy from a distance. That's like the best, right?
Yeah,
just
you
send
don't
your
need
money.
sugar. You don't need the sugar.
Isn't that what you're looking for?
Yes. So if you're
A
out
sugar
there,
daddy from afar?
Yes,
Where
that
you don't
doesn't
give
need
any
any sugar. Mm-mm.
I would recommend, guys. Make sure you get the sugar if you're paying for the sugar.
No, they're good from afar.
Okay, fair enough.
So back to the topic.
Mm-hmm.
So have you seen any, I guess, when people come back from other countries, they recover here, right?
Mm-hmm.
Have you seen any of those patients?
Probably more than I would say I would love to. And I think, the hardest part for us is, and again, whether it's my patient or someone else's patient, is you didn't pay us to do your surgery. You didn't pay for your recovery, but now you need somebody to take care of you, especially when something's wrong. And I think that's what makes it challenging, because everybody's expecting to get care for free, but that's what the emergency room is for, right? Like for things that have gone wrong or there's issues. But understand that in the emergency room, you're not going to have specialists. They might call a plastic surgeon that takes insurance, but they're not doing, usually the people that are doing insurance are doing a lot of cosmetics. That doesn't mean that things don't go wrong in the US, or that just because you stay in town, things don't go wrong. Things go wrong all the time. It's inevitable. That's why they call it the practice of medicine, because you're always practicing to be better, because everybody thinks, well, why doesn't it go perfect? Well, are you a perfect person? Do we know everything about your particular status, even because we do blood work? No. And nobody's body's exactly the same. Even a set of twins might be different on the inside than they are on the outside. So things kind of shift and change. I think one of the worst cases I saw was somebody who I actually follow on social media, who was really reputable plastic surgeon in another country. I won't specifically say where. But I follow him because he does great work. And when this patient showed up and said, hey, I had surgery by so-and-so, do you mind seeing me for a follow-up? And I was like, sure. We do charge to see follow-ups from other patients unless the doctor specifically calls and talks to me directly. Then at that point, because we have a relationship, there is no charge that I charge these particular patients. But I saw her, and she ended up having a hole, I kid you not, this big, where the doctor had put butt implants in. And she was almost, I think, 2 months after surgery. And I could literally put my fist between the hole.
Like an actual flesh,
open hole. Like you could literally see where the bone was and where the dead fat was. You couldn't see the implant, which was good. But more than likely, that would have got infected. And that was one of those things that I told her, I can't just take you back to surgery and close it, because it's literally gonna, what we say, pus out. It's literally just gonna get infected because there's so much bacteria there, that you have to let it heal by what's called secondary intention, meaning it heals from the ground up or the bottom up. But something like that takes a really long time. And that's somebody that I saw maybe 2 years ago. After the visit, I told her, I'm like, hey, these are the things we can do. These are the steps. This is wound care. But I never saw her back. But I told her I would be happy to kind of follow her along and take care of her, but she didn't pay me to do that. And so kind of certain number of visits would be included in the cost. And if we had to take her back to surgery to kind of clean stuff out. And honestly, in cases like that, I say, hey, if you're concerned about needing another surgery, get on a plane and fly back to where you had the surgery, because your doctor, I wouldn't say is obligated, but they should do the right thing, which is take care of you.
What would you think, like, caused something like that? Because
bad luck. But again, you have to understand that when you go to other countries, the protocols that they have in place aren't always up to par. And what I mean by that is, even in the US, there's certain cities where, like, for example, I might do 1 or 2 surgeries in a day for a BBL, for example. There, they might do 6 to 10 in one day.
oh wow,
And if the surgery takes you 2 hours to do it by yourself, even if you're the fastest surgeon, maybe an hour and a half, and you're doing 10, and you have to clean the room, you have to clean the instruments, I doubt that you have 10 different sets of instruments to go through, that they clean them really fast. And because they're maybe not following everything that they should.
I doubt they work 12-hour shifts.
yeah,
Right,
or
they're not.
Don't you think, like, because I saw a video, I don't know how accurate it is.
Where, on TikTok?
Yes, where I research things. But supposedly, like, in other countries or wherever, or some doctors, it's thought to be that, like, they maybe start the surgery and then they leave the room and someone else finishes it off.
They call it a ghost surgeon.
Yeah, so they shouldn't be leaving the room would be the issue. So do you think that could be a possibility of what's happening, maybe?
I used to work in Miami, and that's part of the reason why I particularly left, because it was a numbers game. It was about how many surgeries can you do, and because as a surgeon, you don't get paid a lot to do the surgeries, but if you do 3 at the same time, even though you only have 2 hands and you can't put 2 hands in 2 different people at the same time, that you have other people helping you. But I refused to do that. So I didn't do as many surgeries as everybody else. And if I said no to a surgery, there would be 9 other surgeons. I'll do it because it's money.
Yeah.
So yes, you can delegate your medical responsibility of certain aspects of the procedure, but you own that procedure. So if something happens, you're at fault. And that's how people have lost their license, not because they're bad doctors. It's because I think they've made poor decisions to let other people who aren't them do things that just because you think they know how to do it, they might not do it the way you do it.
But some people know this and they still go to Miami and get the procedures done. So they willingly, and they know. I had a client a couple years ago. She came for a facial balancing, and she
What's facial balancing?
Just fillers, just to kind of make her more balanced all over her face. So she starts laughing when I gave her a quote, and she's like, I paid less for my lipo and BBL in Miami. And I mean, we still did it, but she was just laughing. She's like, yeah, I paid a lot less than what I'm paying you to do my face. And she told me, she's like, going in, I already knew that I didn't know my doctor, and I knew that the surgeon wasn't going to do all my surgery. So she's like, when I was done, I went and bought this big, a box full of wine, and I just delivered it to the staff, because I know the staff was the one that did my surgery, not the surgeon. But she was okay with it.
That's crazy.
Again, it's about implied risk. And again, anytime you have surgery, you are signing a consent form that says you understand the risks, the benefits, and the alternatives to having the surgery that you are having. There is no guarantee from anybody that things will go perfect. Unless their name is God, they cannot guarantee anything, including myself. But part of that is that patient understood that, hey, if something went wrong, I accepted the risk. She accepted the risk of whatever happening. And the horrible part about this is we're talking about traveling abroad, but this happens in the United States all the time. But the worst part is when you go to other countries, you're like, you were mentioning Turkey and a $3,000 rhinoplasty. If I were to Google a flight to Turkey right now and be like, great, I want to be there in 10 days. the flight is not $500. It is not $800. It is not $1,500. But to sit here and say, hey, we're going to charge you $3,000 for an all-inclusive trip where we pay for your hotel, your flight, your food, and surgery.
I don't know if flight was included, but if a rhinoplasty here is like 10 grand altogether.
Not for a good one.
Or like 15 or 20, whatever it is, you're still paying, including the flight, even if the flight was $2,000. If like the whole package is $3,000, you're only
what
paying
if you have to
$5,000.
go back for a revision? That's another.
Yeah, but still less than 20.
Okay, so here's my question.
I'm just saying.
If we're talking about horror stories, and not that there's good surgeons all over the world, guys. That's the first thing I will tell you as a surgeon. There are brilliant surgeons that are maybe a million times better than I am. Depends on the country that they're in. And maybe I'm better than a million other surgeons too. Just depends. But to your point, oh, great, I'm going to spend maybe $4,000, $2,000 on a flight, $3,000, maybe $5,000, right? And you do your surgery, and all of a sudden you're like, gosh, I'm always bleeding from my nose. And then you go see a doctor here after it's been 6 months, and they're like, yeah, you have a hole in your nose.
No, yeah,
like scary. A hole the size of your thumb that if you put your finger in this nostril, it would literally come out the other one, because it's happened. I've seen it. And then you're like, oh, but I paid $5,000, and then at 6 months, your nose starts to collapse. And so now it looks like a ski slope. But hey, you paid $5,000 for it, right?
Yeah.
And now do you know what it's going to cost for somebody to try and fix that? Where you think you want to go back to Turkey to the surgeon that did that to you? Yes or no? No. But now you're spending around $50,000 to have somebody take a piece of your rib to try and reconstruct your nose, take a piece of your scalp at the same time to reconstruct the nose that's been destroyed. And now the best they can do is get your nose to be normal, not even like super cute and perfect. Or you might end up with a chronic infection where you have to be on antibiotics for the rest of your life. Or your nose will literally have issues. And I say all this because I've seen it. I literally saw it when I was at Harvard. I saw somebody show up who had, and this was when I was in training as a resident, and they showed up at 2 a.m, and I'm like, what the fuck? Literally seeing a situation where they were telling me their story, and I literally couldn't believe it. They're like, yeah, I've been on antibiotics every day for the last 9 months, and if I stop them or I miss a couple of days, I'll start having issues.
Because they got a rhinoplasty in another country?
Mm-hmm.
But, I mean, it's not always all bad,
it
right?
It doesn't always happen. But if you are the person, let's say it happens 1 out of 100, you're like, yes, I made it. And then your friend goes and has the best experience, the best result. You're like, hey, I'm going to go there next week. And you're the 1 out of 100, or you're the 1 out of 1,000, or 1 out of 10,000. And now your face is permanently disfigured because you saved $5,000.
So you want to do my nose?
No, not for free.
I mean, but let's mention that could also happen here in the United States. It's not just outside of the United States.
But at least you'd be local and you can see your doctor.
And again, the difference would be in the U.S., you would sue your doctor, right? But there is a difference between having issues and what's called standard of care. It doesn't mean that bad things don't happen, guys. But if bad things happen and the doctor did everything, you could try to sue, but more than likely it's not an issue. But now if they were picking their nose and doing your nose job, then yeah, you could sit here and say they didn't do something that was within the standard of what's supposed to be done. Now, if you get a crazy infection that comes from another country, how did that get there?
Yeah.
That's a different story. I think part of the situation with all of this is I see 40% of the patients that I see literally come from out of town, out of state. I even have patients from other countries that literally have flown to see me. I think the most important aspect is we're talking about traveling abroad, yay or nay, right?
Yes.
And to me, the biggest thing is, well, how can I sit here and say, hey, it's a horrible idea when I see it? And it's not that it's a horrible idea. It's understanding the concepts of what makes it safe and what doesn't make it safe. What is yay about it? What is nay about it? When I see patients, I tell them, if you're coming from out of state, you got to stay 8 nights. Absolutely no ifs, ands, or buts about it. Right? And so I'm making sure that if there are issues, you're here with me to take care of them. That doesn't mean that you can't have issues later, but most of the issues, I'm here to take care of you. If you're flying from out of the country, you have to stay 3 weeks in the United States for me to take care of you if you want me to do your surgery from out of the country. And I'm willing to bet that most people that have surgery out of the country are not staying 3 weeks in that country. You think they're paying for a 3-week vacation in Turkey?
Yeah, I wouldn't say 3
Probably
weeks.
No, it's literally like 2 days, 3 days tops,
I don't
and then
even
get
think
on a
it's a
plane
week, yeah.
and buy. That's the difference, because they know if there's issues, more than likely you're not going to fly back. And if you have an issue, magically that phone that you called where they're like, hey, we're happy to help you, we're going to do all these things, just kind of disappears. And then you end up going to somebody locally that you're like, I don't know how many DMs I get on a given week, like, hey, I love you, I've been following you, I had surgery somewhere else, do you mind seeing me? And I'm like, I'm happy to see you, but there's a consultation fee, there's a reservation fee to come see us to figure out what's going on with you and how we can help you. And that doesn't mean that that's doing surgery on you, but sometimes people come in and like, oh, hey, I have an infection, it's been like 2 months. And I'm like, yeah, you have something under the skin that may need another surgery.
So would you say that's from the surgery or maybe traveling back?
I don't think
where they went?
I don't think it's the traveling back part. And I think
Same with
most
airports are so dirty and they're still healing. If they come back like 2-3 days after the surgery, would you not say they can catch something?
I would say it's possible, but in my opinion, just my novice being a surgeon only, 15, 17 years, whatever it is, once you do surgery after 24 hours, your skin is closed. Okay. Like technically, if everything's done well, your skin is closed and there's a small chance, not zero, that you could get bacteria that goes inside your body. So even if you go to a dirty place, your skin is closed. But now if you don't do it well and the skin wasn't closed right and your skin has little areas where it's open, yes, you could get an infection.
Or if it wasn't like sterile enough to
Correct.
begin with.
And the problem is that most of the time when you're done, they don't use everything that we would use. Like, for example, when I do surgery and I'm done, I close it with medical grade glue. So it's like I put sutures, everything, and then I put an extra barrier to prevent issues. But that glue can cost an extra $100 to $300-$400 extra per patient. If you're paying $1,000 to a surgeon, do you think they're going to use $200 glue? No. So part of that is expectation is everything.
Yeah, I guess it's just how much you value like the quality of, because why most people go, I feel, or why I
Cost.
when I was younger, yeah, it's the
Cost.
cost.
Always the money.
So if you're
Always the
willing
money.
to take the risk, but the way you put it, that's scary. So.
If you take a gun and you spin it and there's only one bullet, would you
Oh
shoot
my
it? Because
gosh.
that's what it is. It's Russian roulette.
Maybe.
5 times, you're not going to get shot. 1 out of 6, you might.
I think people feel safer if they know somebody who's
Had it done.
Yeah, and then they're like, "Oh, you should go see my surgeon. It's here."
Or like online too, like when you see, like you'll see their afters and people are like, oh, who did your surgery? And then they'll put all the info and then they'll relay like what they went through and stuff. So it makes you feel a little more comfortable, but you don't actually know that person. It's just like you said, 1 out of a million that like had a great experience. But
So what would you say? I know you've done your research on traveling abroad. And then for you as well, do you guys know what are the global hotspots for surgery?
is it like Colombia or
Colombia is one of them.
Brazil? No? I'm thinking like Latin places where everyone has a BBL. I don't know.
People do more surgeries than BBLs, right?
No, I know, but that's where my head went first.
I think Colombia is known for lipo and BBLs.
Absolutely. That's where it came
Venezuela,
from.
Then-
maybe?
I don't think people go to Venezuela anymore. People
Not
really
unless you don't want
go.
to come back. It's
they
too
don't.
risky.
Maybe once upon a time, yes, but not right now.
Like Dubai?
I
I mean, there's plenty of plastic surgeons. Like I said, I've been offered to go to Dubai to do surgery and stuff. So that's where they fly in the surgeons, and the surgeon might show up for a week or two, do surgeries, and then fly back to the U.S. So you're still getting a U.S. doctor. that's there to kind of help.
So Colombia is one. Turkey.
Turkey's
For
another
noses and hair transplants.
one. And anything else?
Mexico.
Mexico, okay.
How about
Korea.
Korea?
You said
How about
Korean
like-
surgeons are
yeah.
freaking amazing.
I've
They
heard
can
that too.
literally do
How about
some-
Thailand for gender?
reassignment.
Yeah.
Absolutely.
Oh, I've heard that too.
Yeah.
I
Absolutely.
think you were telling me actually about the gender reassignment.
Like I said, traveling abroad can be amazing if you're like, oh my God, I saved so much money and I'm happy and fabulous. And that's amazing. I'm so happy for you that you had those kind of results. I just always feel bad for the person that saved the money and got back and now they're $300,000 into hospital debt because they've been in and out of the hospital for the last 6 months. And now they're disfigured. Or even worse, people pass away. And unfortunately, bad things happen. That is out of the control of any surgeon. And nobody wants anybody to have that kind of outcome. But it happens. Especially, in circumstances where people aren't, being as careful as they could be from that standpoint. But yeah, all those countries, and the thing is, we have destination hotspots in the U.S. I would say Miami's clearly one of the top places to go and have, the U.S. version of medical tourism when you have surgery there. And like I said, I used to work there. I couldn't keep doing it there.
Yeah. Would you say California is another hotspot? Because I see a lot of, at least on my TikTok, I see a lot of California doctors. I don't know if it's a hotspot, but
I would say there's lots of surgery happening in California, but like for example, Beverly Hills. But you will find somebody in Beverly Hills that'll do a BBL for $4,000, and you will find somebody that does it for $40,000. So it's a big spectrum. But I think anywhere you're going to find that range of people that are on the low end of costs and people that are on the high end. I would say we're not the most expensive, but we're certainly super pricey.
yeah.
But I think, the biggest difference is why the difference in cost? Well, part of the cost is that who's going to take care of you? Literally, when you come see us, you're always going to see me or Dr. Benjamin or Nurse Scottsdale or PA Tao. You're always going to see your provider who's going to take care of you. Obviously, if we're on vacation or out of town, you might see one of us, other people. But the reality is, if we're not, you're going to see us. And that care is going to be there. Like, I have patients that I did their surgery 7 years ago that I see at least once a year. And that's included as part of the cost. Versus you go to travel in the U.S. or abroad, and after your surgery, you're never going to talk or see to your surgeon again.
Yeah, that's it.
What would you say, like, for people who are struggling, like, with cost, but they're trying to justify, like, let's say it's a more expensive doctor, so what should they look for in their doctor when they're doing their research? Like, what specific things?
From my perspective, I would sit here and say, everybody says, hey, they have to be board certified plastic surgeon, right? And yes, that's great, but there's plenty of board certified plastic surgeons that suck. There's no ifs, ands, or buts about it. And there's plenty of surgeons that aren't board certified in anything, but they're better at doing things than board certified plastic surgeons are. Just because you go to school doesn't make it, that you know everything. And that's what makes it challenging sometimes, that I think it has to be about, that's our lovely kids coming in and out of the room, by the way, our two little babies. But the thing about what you look for is you have to see their work, and you have to, make sure it's their work. You don't know how many times I get a DM saying, hey, is this your work? And I'm like, yeah. They're like, well, yeah, it's posted in this other person's website and they're saying it's theirs. And I'm like, I can literally show you the different pictures, not something that I screenshotted and then put it on my website.
I always say just do your research. Like, just research your doctor, make sure it's what you want he's going to be able to give you. Because I see a lot of clients too, and they're like, oh, I saw so-and-so. I'm like, oh, yeah, he's not a plastic surgeon. He's not a cosmetic. Oh, really? No way. I'm like, yes. I'm like, he was a oral doctor.
Oral surgeon.
And
or family medicine doctor, internal medicine, OB.
So we get a lot of that, and they had no idea. They thought they were seeing a plastic surgeon.
So where would they find that? Like their website specifically?
Well, everybody, here's the thing about the US that you guys need to understand when it comes to certification. I could say I'm a board certified doctor. You're like, oh my gosh, that's awesome.
So what does that mean?
Cosmetic surgery has its own board certification, but it's not recognized by the big medical association that says these are the medical specialties that are recognized: ENT, plastic surgery, urology, OB-GYN, family, psychiatry. So the people that couldn't be plastic surgeons created their own certification, called the American Board of Cosmetic Surgery, which some plastic surgeons are board certified in the American Board of Cosmetic Surgery, but anybody could be certified by the American Board of Cosmetic Surgery. You didn't have to go to school to become a plastic surgeon. You could be a psychiatrist and be like, come follow me for a month, take a test, and you could receive your board certification. Now I think they've gotten a little bit more strict about having to do a fellowship in cosmetic surgery, but the fellowship is, I don't think, as regulated as what we have as plastic surgeons. So you have to do X number of procedures in this, and this, and if you don't, you can't be board certified. There, if you have a minimum of this or this, then great. You sit for your exam, and just because you know how to take a written test or answer questions doesn't mean you know what it is to take care of a patient.
But they can still do surgery without this certification.
Absolutely. Anybody can do any surgery they want in their office.
If they're a doctor already.
And a doctor, that's it. All they have to be is a doctor.
And
I can literally be your OB and be like, hey, do you want me to do your boob job while I'm there?
Yeah, I see a lot of anesthesia providers too doing surgery.
Correct. They're the people that give you the medicine that helps you go to sleep.
This is why we needed clarification, because it's so confusing out there.
I think the easiest question that you can ask, guys, if you really want to know the tough question to ask anybody, is, can you do your surgery for me at a hospital? Hospitals, by law, are required to have board certified surgeons in their scope of practice. Meaning, if I'm a plastic surgeon, I couldn't sit here and go to a hospital and say, hey, I can do your C-section. Could I? Probably, yes. Would you survive? Probably. Not a guarantee, but that's not what I do. But your OB couldn't go to the hospital and say, hey, I want to do breast augmentation. The hospital wouldn't let them. They'd let them deliver a baby, but they wouldn't let me deliver a baby because that's not my specialty. Mm-hmm. And I'm not calling out on any particular doctors, but it's one of those things that the easiest question you can ask is, can you do this surgery at the hospital for me? And if their answer is, oh, well, I don't go to the hospital. That's not the question that I asked. I said, can you do this surgery at the hospital for me? And if the answer is no, then they're not certified.
But you don't know what you don't know. Like my first surgery, I went to an ENT.
Who was a plastic surgeon?
He wasn't, but I thought he was a plastic surgeon.
But did he tell you he wasn't?
No, he never told me. And
he said, I'm a board certified facial plastic surgeon.
Or cosmetic surgeon.
Cosmetic surgeon.
And I was like, okay, well, I guess he can do my boob job. And I was just not happy with my results. And then later I found out that he was an ENT.
So what were you unhappy with? Like, what did he?
Just my whole results. Yeah.
He just.
But here's the thing. If you go to school for 5 years to train from the head and neck, that's it, 5 years. So as a plastic surgeon, a minimum of 3 years doing from head to toe, a minimum. And to be a board certified plastic surgeon, you either have to have a minimum of 6 to 8+ years of surgical training to say you're board certified. If you wanted to be an ENT, you would do 5 years of ENT and then do 3 years of plastic surgery to say you're a board certified plastic surgeon, even though you're an ear, nose, and throat doctor. But if you think about it, you spend 5 years on the head and neck, and then you're like, hey, I can do your boob job too. And again, that doesn't mean that you can't, and you might not be better than other surgeons doing boobs just because you're naturally gifted and you get the aesthetics. But it's one of those things that you have to understand there's differences. And again, the scope of practice for everybody is what it is from that standpoint. So it's hard to say, because I always tell people any doctor's entitled to do whatever they want. I have no problem with it. But if you're choosing to do whatever it is that you want to do, you better make sure that you know how to take care of the problems. Meaning that if somebody's unhappy with a result, that you know how to fix it. That doesn't mean you know how to fix everything, but it's one of those things that if somebody's unhappy, you better be able to fix it. Does that make sense?
Yeah.
And I mean, I've seen some really good work, though. I mean, with other surgeons that are not plastic surgeons.
Absolutely.
And I mean, they do amazing work. So I'm not saying that it's not just plastic surgeons who you should go to, but just research. Just do your research, because you don't know what you don't know. I never did my research. I thought like, oh, he's a cosmetic surgeon. He must know how to do everything.
And like I said, you know, I agree with everything you're saying from that standpoint. I'm saying there's plenty of good surgeons that are not plastic surgeons.
Yeah.
But you have to understand, the question is, if you don't get the result that you're looking for, can they fix it to where you're going to be happy? And that doesn't mean that I've done surgery that people are not happy with, because if I said everybody's happy, I'd be lying. Or it means I haven't done enough surgeries. It's just inevitable that you're always going to have a person that's unhappy with what you do for them. And usually that's more of a communication issue than it is an expectation issue, because you should say you do this and give this, not say I'm going to do this and the patient's expecting this. So they're going to be unhappy even though it's better.
Yeah, I think for like someone who doesn't know, like it's just hard to know the questions to ask. So that's why I'm like, what would you say or what would you research and stuff, because it's hard to like navigate that sometimes because there's so many surgeons out there. Like I didn't know there was a difference between cosmetic and like in a regular plastic surgeon. Like there's so many things out there that it's hard to.
I think also like reviews are also really good. Pictures before and afters, making sure they're not just like stock photos.
Yeah.
You know, I hate to say this, but I would sit here and say, hey, look at their social media. Are they actually doing the procedures that they're talking about? And do you get to see a result as it's going? So it's one of those things that I post a surgery I started and you get to see what it's going to be like. I don't get to like cut it off halfway.
Yeah.
So staying local is not always better either.
Well, I said that at the beginning.
Yeah.
If you live somewhere where the results aren't what you're expecting, then you're going to have to travel to get the result that you're looking for.
Yeah.
So that's part of the yay, nay when it comes to traveling abroad. Like I said, 40% of the patients that I see are literally from out of state.
Well, out of the country too. I mean, you've had patients, I mean, I know from like Japan, from France, from Germany, from Dubai, Mexico, Canada.
Yep. And like I said, you know, it's not to sit here and say that we're better than any of the surgeons in those countries. It's just everybody's entitled to get whatever it is that they expect to get. And that's ultimately what it boils down to, is getting a result that you're going to be happy with, regardless of whether they're certified or not certified. That's going to make you happy. And like you're right, it is a minefield, and you hope that you get lucky, but ultimately reviews, before and afters. But understand, people buy reviews. People steal pictures. People will lie. People will say they're board certified. And so there's no true way to know for sure.
So what kind of tips do you have for everybody watching that are interested in surgery, or maybe they're looking up a few doctors to...
I would sit here and say, at a minimum, do a virtual consultation. That means you're physically going to meet the doctor on Zoom or, you know, whatever HIPAA compliant thing they kind of have. We use something called Doximity. You can FaceTime your doctor. But you want to have them see you and assess you and see if you have a vibe with them that you're like, hey, I trust this person. That would be one of the biggest things. Obviously, pictures, reviews. Ask for references to be like, hey, can you let me talk to one of your patients? Or if they have testimonials of patients, you know, on their social media and things like that. And I hate to say this, but look at their reviews, but look at the bad ones. Everybody will look at the bad ones first, not just the good ones, and go through them. And if it's only on Google or it's only on Yelp, why? I mean, you should have reviews all over the place, because not everybody uses Google, not everybody uses Yelp. There's got to be reviews all over the place.
That is true, because if I'm ever looking for a new restaurant, I always look at the bad reviews first, and if they're not that bad, then I know it's
and just read them, because I know some people's like, oh, I didn't like the building, or oh, I didn't like the door was hard to open, and just like dumb stuff, you know.
Yeah.
Like that's a reflection of the bigger picture. But I think as society now, because of social media and we can hide behind our phones, that we'll write anything versus no one will sit here and tell you to your face, I don't like you. This was horrible service. They'll be like, oh, everything, like we say this all the time. Oh yeah, the food was fine. It was good. And then you're like, God, this food totally sucked. Tasted like shit and cardboard. And I would never come back to this dump. But when you check out, you leave them a tip and you're like, hey, thanks. And then you go talk shit about them.
Yeah, you go home and leave a bad review.
cry.
But usually, if we go out to a nice restaurant and we like, oh my gosh, this food is amazing, we're not gonna go home and write a review, right? Like, oh my gosh, this was amazing. But if it was bad, you're like, oh, I'm gonna write a bad review.
Yeah, and then you exaggerate because you're like upset and stuff. Yeah.
You know, the thing that I would add about all these things is, fortunately or unfortunately, I've had exposure to taking care of people that have bad outcomes. I've seen somebody who lost part of their penis as part of having, because I do something called the magic shot. This is where we inject filler into the area down there. And most of my patients were from out of town because it's a very specialized thing. And they had it done and they lost part of the head of the penis.
Where did they get their penis done?
It was in another country and they ended up getting an infection and you can't put that back. And so people are like, oh, why do you charge what you charge? I'm like, I charge for the procedure because the products that we use are expensive. And it's one of those things that I also took care of, I think, at least 20 women that went to somebody's house
Oh, yes.
and had lip filler for, I think, $90 or $100 per syringe. And in one day, this person would see like 100 patients.
Oh my gosh.
Actually,
So-
yeah, it was like,
It was
like
like
really cheap.
Yeah. And so she
What
would buy
was it?
product from Mexico. And she said, oh, hey, it's filler. If you don't like it, we can make it go away. Well, I guess she got, and again, because the product that they get from Mexico is not usually made in Mexico. It's kind of made in China and then shipped and processed and whatever. And so she injected a bunch of people that ended up going to the hospital, having pus come out of their lips, being in the
That's so
hospital with
scary.
antibiotics and getting disfigured. And I took care of one, and next thing I know, I was taking care of people. Like it made the news. It was all kinds of stuff.
Yeah.
And then magically, this lady disappeared. Like the news went to that house, and she literally moved back to Mexico.
I think she came back though. I heard
she?
she's
Did they
back
ever-
and doing something different, but yeah.
Did they ever figure out what it was?
Well, I saw a few of the girls too. One, I guess she worked for a derm, and they took a sample, sent it to the lab, and they found traces of silicone in
They're
there.
putting silicone like in.
Well, we put silicone into implants. Why not put
I
it into
know,
the
but,
lips?
Like it's just loose. In there.
It's called Silicone 100 or 1000. So it's actually FDA approved to go in your eyeballs. But people will use it off label, meaning that as a doctor, you can use it wherever you want. And people are putting it into butts, into penises, into a variety of areas. And yes, it is a permanent result. But if it goes bad, it's bad forever.
I mean,
I
this,
can't imagine that's like the most sterile or like the most, you
I mean,
know.
these poor girls were just, I mean, you should have seen them. It's hard to not look at them and not stare because their lips were just so big and just like
pus coming out.
yeah, just like with like, it looked
Did
like
you
they
have
had
to cut them
blisters.
open and?
Oh,
like-
yeah. And I still see people that will refer other people who've had bad lip filler and, oh, I went to have it dissolved. They said it was dissolvable and they've had it dissolved 4 or 5 times and it's still the same. And
It's something else. It's not hyaluronic acid. It's something, they don't know what they had. They think they're getting one thing and then they end up getting something else. But yeah,
you know,
just gotta be careful.
and I feel bad, but it's one of those things that we all make choices, right? And just because we're saving money, all of a sudden we may not save money and spend a heck of a lot more money than if we had just, instead of 100, paid $500, $600, $700 for that lip filler and been happy with it.
That's scary.
But there you go. You can get it for $100
Well,
in somebody's
glad I have
house.
you guys.
So what is our word of the day?
Our word of the day is going to be nay, N-A-Y. And what are you going to win this week? You actually win a t-shirt from the office. Again, if you guys have questions or concerns, send us a snap, a DM. What do we call messaging on TikTok? A DM?
DM.
Yeah.
Okay.
Is everything called a DM?
Yeah. Direct
What
message.
about a tweet?
Yeah.
Is that a DM too?
We have
Snap.
threads. We don't
We have
really-
threads. Yeah, we don't get a lot of threads.
Yeah.
But yeah, I mean, this was a really hard topic this week because traveling abroad can save you a lot of money, but it can almost ruin your life or even take your life. So just be conscientious and understand that,
Research.
yes, everything carries risks in plastic surgery. Nobody can guarantee anything. So that will be that. Next week, we're going to be talking about what?
Have a hot topic next week.
What's our hot
Kind of
topic, Alondra?
excited.
I'm scared.
What is it?
It's about intimacy and sex, so I will not be joining. No, I'm just kidding. But
Just because you don't have any?
no, because I don't want to hear y'all talk about it. I'm already traumatized. The
Well.
PTSD is already hitting, so
Hey, how do you think you were made?
I was made by the Lord
Just
Himself.
bring your
My mother
notebook
was a
and
virgin.
take notes.
Okay.
Next week, okay?
Nasty.
All right, there you guys go. We'll catch you guys next week. I hope you had as much fun listening as we did recording. Don't forget to follow us on Spotify, Apple Podcasts, and all podcast sites for new episodes, as well as Instagram, TikTok, and YouTube. Stay snatched, stay hydrated, and until next time, cheers.